Your health is your greatest asset, but navigating today's wellness landscape can be overwhelming. Well, we're here. Let us little by little learn all these together, of course with the help of our health experts.
Real stories of recovery, the science of everyday wellness, will answer our biggest health questions.
I'm Pier Pastor, hosting with me is Dr. Brian Buendia, interventional cardiologist from St. Luke's Medical Center BGC. Let's get to the bottom of well-being today. You are watching Wellness is Wealth. Also known as Lou Gehrig's disease, Amyotrophic Lateral Sclerosis, or ALS, is a progressive neurodegenerative disorder that affects motor neurons, the nerve cells responsible for voluntary movements. ALS is terminal. There's no cure yet, and patients just eventually die from respiratory failure. Up to this point, causes and risk factors are not yet fully understood. 90 to 95% is sporadic, or it occurs without family history, while familial ALS is just 5 to 10%. Worldwide, the prevalence of ALS is about 4 to 5 cases per 100,000 people. Rates are lower in the Asian region compared in Europe and North America. In the Philippines, there is no comprehensive national ALS registry yet. An estimate of 0.4 to 3.3 cases per 100,000 are diagnosed annually. And the challenges remains the same: delayed diagnosis, high cost of treatment, financial burden to families, inadequate palliative and long-term care systems. Many patients lack access to neurologists.
ALS is being fought quietly, inside homes, hospital rooms, and within families trying to hold on to hope. In the Philippines, support groups such as ALS Philippines have become a lifeline for ALS patients. Wellness is Wealth team met two women who have fought ALS on behalf of their loved ones. One of them is Pai Perez, the sister of a once vibrant singer who's now slowly losing everything to ALS, except the unwavering love and support of his family.
Michael Ian Mostajo was a good singer. But the wedding singer lost his melody.
Maging ang kanyang pagsasalita at pagkilos, inagaw ng sakit na Amyotrophic Lateral Sclerosis o ALS.
Hi, my name is Mike. I'm 42 years old. I have ALS, a motor neuron disease.
2019 na magsimula ang mga sintomas ni Michael. Nagkaroon siya noon ng paminsan-minsang muscle twisting at laging nagka-cramps ang kanang braso at kamay.
Ang initial diagnosis was carpal tunnel syndrome. Tapos actually he was due for operation. Tapos parang hindi convinced yung doctor niya, so nag-run pa ng more tests.
Matapos noon ay unti-unti siyang nagkaroon ng muscle atrophy o lumiliit ang kanyang mga muscles habang nanghihina, kahit may mga gamot at therapy. 2021 at the height of the pandemic, naging prominente na ang panghihina ng maraming bahagi ng katawan ni Michael. Sa taong ito, clueless pa rin siya at ang kanyang pamilya kung ano ang kanyang sakit. Pero taong 2023, sa patuloy na mga tests kay Michael dahil sa pagkawala ng functions ng kanyang katawan, dito na lumabas ang diagnosis ng doktor: motor neuro disease, specifically ALS.
Noong 2023 nga po siya na-diagnose. Prior to that, parang ang dami pong ni-rule out na sakit or parang mga syndromes na related, associated dun sa symptoms niya. Pero noong 2023, nung sinabi na yung diagnosis, final naman, sinabi na sa kanya ma'am na walang cure, yung life expectancy was 3 years.
Di maiiwasan sumunod na dito ang depression, anxiety at panic attack, lalo na at naging fully dependent na si Michael sa kanyang mga tagapag-alaga ng kanyang mga magulang at mga kapatid.
Dahil nga yung respiratory problem ang main nila, yung may time na nahirapan siyang huminga, so sabi niya feeling niya nalulunod na siya.
Devastating ayon kay Pai, lalo na ang gastusan sa pagpapagamot na milyon-milyon ang inaabot. Dahil may panahong matagal na nananatili si Michael sa ICU, ipinagpapasalamat na lang ng pamilya ang mga tulong na dumadating.
Talagang yung support din po ng relatives, ng friends, ng kahit ng mga ibang strangers na tumutulong din sa amin financially, tsaka yung mailapit kami sa mga government agencies. May isang nag-reach out sa akin na isang friend na sabi niya, "Uy, may kakilala ako sa Office of the President, ganyan. Ba, try natin ilapit." Although hindi niya ka-close. Then sobrang naiyak ako, ma'am, nung binigay yung GL sa akin, yung guarantee letter. Kasi it's six figures na malaking tulong talaga. Yung 600,000 na yun, ma'am, parang almost half na nung binabayaran namin na promissory note sa unang hospital, ma'am.
Sumubok ang pamilya ng kung ano-anong paraan, alternative, traditional at iba pa. Binigyan din si Michael ng isang gamot na magpapabagal sana sa progression ng kanyang ALS. Pero pakiramdam niya ay lalo umano itong nagpapahina sa kanya. Nag-cardiac arrest si Michael nitong nagdaang December 7 lamang. Matapos nito, lalo nang lumala ang kanyang kondisyon. Nag-tracheostomy na siya o binutasan ang kanyang lalamunan para lang makahinga. Sa ngayon, nasa total vegetative state si Michael. Gumagamit siya ng eye tracking device kung saan itinuturo ng kanyang mga mata ang mga letra para masabi ang kanyang kailangan. On ventilator na rin siya at 24/7 ang kanyang caregiver. Kahit tanggap na ng kanyang pamilya ang maaaring mangyari, hindi nawawala ang kanilang tiwala na baka may magbago pa.
Yung hindi kami nawawalan ng hope, although sabi ko nga, ma'am, kasi nagpo-post ako palagi tungkol sa kanya na we have accepted yung physical healing is no longer possible. Pero nagpe-pray pa rin kami, ma'am, na baka sakali. And yung magkaroon lang siya ng yung at least siya pag umalis siya.
When I was diagnosed with ALS, I wasn't afraid of dying or not being able to mow, but my biggest fear was losing my voice. So now I'm grateful that I could still communicate through this amazing device. God is really good all the time.
Devastating, Doc, no? Mabuti na lang sometimes meron silang faith na parang nag-ano lang din, nasusustain sa kanila.
It's heavy on everyone.
Yes, oh.
Patient, yung mga relatives,
Yes.
support group. It's very important to support group.
Okay. Now, joining us this Sunday morning is Dr. Lina Laxamana, internist, urologist, and neuro-critical care specialist. Dr. Laxamana is the head of Neurology Department of St. Luke's Medical Center in BGC. We are excited to have her share her expertise with us today. Good morning, Doc.
Good morning, Ma'am Pier and Dr. Ryan.
Morning.
Nice to be here.
Yes po. Okay. I am with two gods in the medical field. So, meron akong cardiologist at meron tayong neurologist. So, yung cardio is the lifeline and the neuro is our control of our functions.
Yes.
Ayun. So, Doc Lina, eto po. Ano po ba talaga itong ALS?
Yeah.
Amyotrophic Lateral Sclerosis. Okay.
ALS or Amyotrophic Lateral Sclerosis is part of a neurodegenerative disease. When you say neurodegenerative, yung ating cells nagde-deteriorate, nagde-decline over time. If you talk about the medical side, dalawang klase po kasi yan, no? There are neurodegenerative disorders that can be genetics and sporadic. And yung essentially ang ALS is part of a motor neuron disease. Dalawang kinds po yun. There are upper motor neurons and lower motor neuron affectation. When you talk about upper motor neuron, this actually starts from the brain.
I see.
Okay,
I see.
brain in the motor cortex to the brainstem and the spinal cord.
Okay.
Whereas your lower motor neurons affect the spinal cord and the muscle and the nerves itself. So, merong mga ibang neurodegenerative disorder or motor neuron disease that will primarily be upper motor and lower motor neuron. But for ALS, it actually affects both.
I
Upper at saka lower motor neuron.
Okay, okay.
Doc, there are types of ALS, like familial and sporadic. Can you discuss further on that?
When you talk about genetics, muna siguro, no? We say about 5 to 10% will be genetics or familial. And this is because namana, because there's a specific gene that this family has and namamana siya. But the rest of the patients may be sporadic in nature. Kanaka-naka, magkakaroon ng ALS or symptoms for no known reasons. But they have attributed it to a lot of factors. No? For example, environmental stress.
Okay.
Siyempre, meron tayong gaya ng cancer. Pwedeng merong plastic, yung plastic that contains, that we use to contain food or water, environmental exposure like solvents or insecticide for that matter.
Okay.
No? So yung dalawang klase ng ALS, upper and lower motor neuron, primarily ALS is number 1. There's also a primary lateral sclerosis, which we call, that only affects upper motor neuron. And pag lower motor neuron, it's usually called primary progressive muscle atrophy. And there's also what we call as spinal muscle atrophy and a primary dysarthria, yung bulbar palsy. So ano bang ibig sabihin ng upper motor neuron? When you talk about upper motor neuron, ito yung mga nanghihina, nagkakaroon ng spasticity or you know, matitigas yung kamay, nagkakaroon ng hyperreflexia. If you do the neurological examination, nag-hyperreflexia po sila. As opposed to lower motor neuron, mostly weakness.
Okay.
Weakness, fasciculation, gumagalaw yung
Parang,
certain portion of the muscle.
Tremors?
Nagkakaroon ng twitches, either legs, the tongue, for example. Kasi kaya yung mga ibang pasyente, nauuna yung muscle twitches in the tongue. Okay, yung iba, nauuna, problema sa kamay, hand, and then the foot. Yung iba, nauuna rin yung pagbubulol. We call dysarthria.
Alright.
Dysarthria.
Then, Doktora, yung distinction of ALS, what makes it distinct from other motor neuron disease?
Okay. Yung sinabi ko kanina, when you talk about ALS, primarily dalawa ang involved, upper at saka lower. Yung isang type of neurodegenerative or motor neuron disease, which we call primary lateral sclerosis, is just affecting the upper motor neuron. Pero yung tinatawag na primary muscle atrophy or progressive muscle atrophy is lower motor neuron. Mahirap pong i-distinguish, pero you also make sure that your doctors explain all of this to you. Kasi although pareho naman ang pupuntahan, but the diagnosis is really essential when you make the diagnosis.
Okay. Pero Doc, pag kayo nakita nyo isang patient agad, nakikita ba kagad kung...
Depende po. Because some patients will just complain of weakness.
I see.
So that is the start. But you have to run through them
Series
and
of tests.
follow up over the next months and even years. Kasi you cannot really make the diagnosis unless the patient really presents to you talagang full-blown na. Merong upper motor neuron, tsaka may lower motor neuron. Yung iba, hindi mo na nila pupuntahan ng doktor no? Mahina lang.
Baka
Pero
nanghihina lang. Ganun.
Nanghihina lang. Pero yung iba, talagang darating na doon. Bulol na, hindi na makalunok, or nagpa-paralysis. May paralysis na.
Okay, so there is no known cause of ALS, but at least what are the predisposing factors to ALS and what will happen to the body once the motor neurons are damaged? But before you answer that, Doc, we'll just take a quick break. Keep it here on Billionaire News Channel. Wellness is Wealth.
Today, on Wellness in Motion, we will slow down and take a closer look at the true meaning of mobility. Certain conditions, illness or disease, can create barriers within the body itself. That's why physical activities and exercises are vital in ALS care. Mass General Brigham, a non-profit integrated healthcare system based in the greater Boston area, classifies ALS exercises into different categories.
According to Mass General Brigham, exercises for ALS care can be divided into 5 categories: breathing, stretching, aerobic, resistance, and balance. Each exercise is designed to support function and quality of life of ALS patients for as long as possible. First and foremost, breathing, which is essential to life. Respiratory or breathing exercises support the strength of the muscles involved for breathing, coughing, or swallowing. Instead of relying solely on the chest muscles, techniques such as diaphragmatic breathing and resistance-based breathing may be recommended. Stretching is for mobility. It plays an important role in maintaining flexibility and preventing joint stiffness. Low-impact aerobic exercises can help support cardiovascular and overall endurance. Walking, stationary bike, and swimming are typical activities that focus on maintaining circulation to avoid fatigue. Resistance is for strength. These exercises are carefully introduced and should be very light. Light weights or body weight exercises can help preserve muscles. Finally, balance exercises support stability, independence in daily activities, and can help reduce the risk of falls. Medical experts, especially physical therapists, can develop a special program for the ALS patient.
So briefly lang, Doc, can that exercise really help ALS?
Yeah, oo. Yung mga exercises can really prolong your asymptomatic period. It can, just like exercise by the name itself, it can do good to the patient who has weakness.
May ready, Doktora, na like, for example, programs, na rehab programs for ALS
That
patients
one
specifically?
has to be analyzed or evaluated by the rehab doctor and eventually carried out by the physical therapist.
All right.
Oo.
So, Doc, what are the predisposing factors of ALS?
Okay. So just like any disease, syempre we talk about the age, the sex, sino ba yung mga involved na race, no?
Yes.
At saka yung genetics. When you talk about age, well, we know this is neurodegenerative. It can happen 50 to 75 years old. But we've seen
Younger.
a couple of patients who developed at 30 or 40 years old. In fact, yung sa US din, no? Masyadong marami na yung incidence nila, like 5,000 in a year. Dumadami sila. It's just that in the Philippines, hindi natin masyadong nare-register.
Okay.
Okay.
But
Now,
it does not mean na konti lang tayo.
Yes,
I
oo.
see. Okay.
while in the ethnic side or racial side, by registry, the most common ALS group happens in the Europeans or in the US.
Okay.
Gaya nung kaninang na-post natin, it happens in 2 to 4 per 100,000 population. Dito sa Asia or African Americans, mga ano lang po yan, 0.8 to about 1% or 1 per 100,000 population. So, when you talk about the age naman, ang age is, when you talk about sex pala, it predominantly happens among males. Bakit male? Tatanong natin, ba't male? They say that hormone among females, which is essentially estrogen, is protective against inflammatory process. So that is one. The other one is environmental. Males are mostly exposed to physical activity,
Pagod. Ganun.
pagod,
Bad environment, chemicals, and all.
chemicals, they're more exposed. Yung mga military service, sila yung pumupunta sa mga militar, sila yung na-expose sa trauma.
Okay.
Oo. Tapos yung genetics nga, no, we have to know kung siguro kailangan talagang itanong when patients come into you, tatanong ba, meron ba itong genetic problem?
Alright.
And then yun yung nasabi ko kanina, yung race. It's
Yung
more
race.
common among Europeans
Europeans
than
and
Asians.
Mga
North
non-Hispanic white
I see.
population.
Oo.
Okay.
Oo.
Alright.
Dito naman, Doc, sa Philippines, based on studies and experience, what have you learned from our cases? Background, lifestyle, age, may pattern po ba tayong nakikita?
Actually, personally, wala akong nakikita. The patients that come to the clinic, they're essentially younger population. I've had 30 years old, 40 years old,
Okay.
very active. Dalawa, merong talagang are males, no? Yung isa,
Female.
female. Pero from the hospital, nakakakita na rin tayo talaga ng dumadami sila over time.
Nagpapatingin.
Na nagpapatingin po.
Alright.
Oo.
Ito siguro yung nagawa ni Eric Dane. Siya yung
Yeah.
ating, si Max Timmy siya sa Grey's Anatomy, Dr. Sloan. And then he just died last year. So, very devastating kasi napakagwapo niya, di ba po? Napakamatipuno. And then suddenly, naging ganon. And then meron tayong si Pierre Denny of Emily in Paris. So he just died this May. Doc, he just died this May. Tapos po, of course, Lou Gehrig, a baseball superstar, in the 1930s, na dun kinuha yung pangalan nung sakit. Doc. So,
ALS.
wala bang kinalaman, Doc, na ikaw ay makisig? Ikaw ay very, very healthy or health conscious or you, ano?
As I said po kanina, yung physical activity is essentially one of the predisposing factors. And you know, yung mga more into sports, laging nagkakaroon ng physical trauma, have been found, have been documented to be more predisposed to developing ALS. Oo.
Doktora, in terms of ano naman, let's talk about the signs. Ano naman po yung napapansin
Okay.
yung initial manifestation at the early stage?
At the early stage, so yung patient will essentially come to you with weakness. Whether weakness ng kamay or weakness ng paa. And then, baka hindi pa magpatingin until they find out na lumiliit na. So, nagkakaroon ng atrophy na tinatawag or muscle wasting. Also, they will have signs of twitches in the tongue.
Paano ba ang twitching ng...
Twitching yung pong mild muscle movement, parang nafe-feel mo na gumagalaw yung mga muscle mo.
In the tongue.
In
So,
the tongue.
nabubulol, Doc.
Eventually, nabubulol sila. Pero yung may tinatawag tayong nauuna yung pagkabulol or hirap lumunok.
Hirap lumunok.
Or pwede ring mauna yung sa paa or sa kamay.
Okay.
So that is weakness. And then over time, they become spastic. When you talk about spastic, para bang naninigas.
Okay.
Oo, naninigas. And since motor neuron disease, basically yung ALS will affect motor neurons. These are basically cells, brain cells in the body that control voluntary muscle activity.
Yes,
So
yes.
muscle activity will mean
Walking.
activity walking, writing,
Oh my gosh.
feeding, paghinga. Essentially and eventually, the muscle of swallowing will be affected and
Breathing.
respiration.
Okay.
Kaya yung iba na talagang late phase already,
Na nakikita.
na nagagawan na natin ng tracheostomy, gaya nung napakitang video po
Case
kanina.
Alright.
Oo.
Doc, konti lang. Bakit po nag-waste? Bakit po lumiliit
Kasi
ang
yung
muscles?
nawawalan po ng innervation, yung muscle because of the nerve degeneration.
Okay.
Remember, ang nerve supplies your muscle. This is the nerve, magsusupply siya ng muscle. Pag sira ito,
Okay.
manghihina
Wala na.
yung muscle.
Liliit na siya.
Wala na
Liliit siya.
stimulation eh.
Alright.
Oo. Kaya initially, weakness lang yan eh. Tapos pag tumagal, nagde-decline na.
Okay. Pero Doc,
Nagde-deteriorate
yung
na.
stage na yon na kapag pumapayat ng
Later.
lumiliit, is that later stage
Yes,
already?
oo.
I see.
Oo.
Okay. Okay.
So, those are the early stages, Doktora, but medyo mas mabigat sa patient and the relatives is yung near end stage or yung late stage.
Yeah. oo.
Paano po ba umaabot sa like according to the video kanina na case natin, yung vegetative state.
Oo. Well, when you look at the evidence, some will say 3 to 5 years lang ang survival, no? But there are medications that can help. Kaya tumatagal sila. And there are support groups. And even your family, if they're very supportive, tumatagal naman yung survival rate. Of course, ano bang treatment na gagawin natin? I-try nating mag-physical therapy. Try natin mag-speech therapy. In the end kasi, kapag yung hindi na sila makakain because lumiliit na nga yung muscle ng swallowing at lumiliit na rin yung muscle for breathing, yun ang time na nilalagyan natin ng tube to help them survive through food intake, which is what we call as PEG, no?
PEG.
Yung isa naman, para makahinga din sila, lalagyan natin ng tracheostomy.
Alright.
And minsan, kailangan talagang yung tuloy-tuloy na ventilator, respiratory support, ang tawag doon.
Okay.
Tapos, Doc, bakit as we mentioned before, why are there different types of life expectancy? Is it because of the patient care or paano ba? Because of the medicines?
I would say that because yung, if you will read the journals or yung mga evidence na nakikita natin online, meron silang sasabihin na gamot. And these medications are no joke kasi mahal sila.
Okay.
So not all, especially Filipinos, can really afford these medications. But yung mga gamot na to talagang nakaka-survive, nakaka-lengthen ng survival.
Proven na po yun na
Proven naman po, meron namang mga evidence, no, na ginagawa yon. At saka, yung mga therapy natin, therapy, both speech and physical therapy, lalo na yung physical therapy, you know, you want to be independent din.
Okay.
Mahirap pag walang therapy talaga. And this is very costly for the patient.
Gaya nung nabanggit nyo kanina, Doc, 60 years siyang meron. Pero,
yeah, si Stephen Hawking,
yes,
he was diagnosed at 20 years old. And you know, ito lang namatay, recent lang din siya namatay. And he has, I think, all the support. He is a very intelligent person.
Maybe she kept on reading about it or asking about it. Okay. Pero I'm sure, gastos yun na malaki, Doc, diba?
I'm sure.
Pero ganun kahaba, pwede pala. We can manage the
yeah,
patient.
Kasi meron hong mga ginagawang treatments for him, no? Yun nga, maganda ang intelligence niya, no? So he keeps on, you know, finding out researches, new research. In fact, yung I've heard around 1 to 2 years from today or from 2025 that they're into getting a good medication to address the motor neuron.
Okay.
And that is something, that is hope for us and for patients who are suffering ALS. No? Kasi isipin natin, ako, pag binigyan ka na ng diagnosis ng ALS, it's really a hard diagnosis to accept. It's no joke.
Yes.
Para ka bang na sabihan na may cancer ka, that there's no cure. But if you have the proper support, you can go you can move on, no?
Okay. Ayun, nakita ko yung smile ni Doc. If you have the proper support, we can move on. Ayun. Now, how do we manage ALS? Pag-uusapan natin yan when we return. Keep it here on Billionaire News Channel, Wellness is Wealth.
To 5-year survival, that's true If you cannot afford all of this very costly, pricey
treatment and management. Yun. Ito. The A in ALS stands for Amyotrophic, which means lack of nourishment to the motor neurons. That's why the muscles of ALS patients gradually weaken. And as the muscles become weaker, chewing can become more difficult. To help families manage these challenges, the ALS Association developed a guide called Maintaining Good Nutrition, a guide for ALS families and friends, to help patients and their families live their full lives.
A high-calorie, high-protein diet is standard clinical care for ALS patients, according to the ALS Association, to prevent dangerous weight loss and muscle wasting. This nutrition plan protects the muscles and preserves strength for as long as possible. To avoid choking, a person with ALS should never eat alone, so preparing the recommended food may take more time and extra care. To help boost calorie and protein intake, choose full-fat dairy, lean meats, eggs, and yes, protein shakes.
Choose soft, moist foods since they are often easier to eat, such as omelets, soufflés, or baked pasta with extra sauce.
Adding gravy, sauces, or even extra mayonnaise to salads can make food easier to swallow. Healthy fats provide dense calories without adding too much volume. To incorporate olive oil, avocados, nut butters, and seed into meals. Thicker liquids are also often better tolerated than thin drinks. One simple option is an ice cream milkshake, made with milk, ice cream, instant breakfast mix, and a thickening powder if needed. Top it with whipped cream for a boost. Ice cream milkshakes are excellent for people with ALS because they are high in calories, soft, hydrating, and easy to consume. Adding milk or protein powder can further boost their nutritional value. ALS patients are advised to sit straight and upright for 20 to 30 minutes during meals, so gravity can assist food to go down. Patients can also be nourished through feeding tubes to avoid choking.
Pero Doc, kasi in 1930, yun nga yung kay Lou Jerry's.
Oo.
Bakit from there hanggang ngayon?
Usually naman physical activity yan. Soccer
Athlete
player
kasi
siya,
siya.
tsaka
Athlete eh.
football player. Siguro laging na
Natatamaan ng
babagok
bola.
yung
Pwede din,
ulo
pwede
niya.
din.
Yes,
though. I
yes.
see, okay.
Oo.
Alright.
Okay. There is no known cure yet for ALS, but there are medicines and treatments given to delay the progression of the disease. Paano po ito nag-work, Doc Lina?
Oo. At the present time, napakamahal ng mga gamot.
Yes.
One is called Riluzole. It's usually given 50 milligrams 3 times a day. And then there's another medication that we have in the Philippines. It's called Edaravone, which is basically oral and given IV also. Now, it works through molecular, yung mga anti-oxidative process, anti-neuroinflammatory process, yung mga ganon, sila nagwo-work. But if you look at really the therapy for such patients, it's basically more of the therapy, physical therapy,
Rehab
the
pa rin.
speech therapy, rehab, tuloy-tuloy.
Okay.
Oo.
Para magtuloy-tuloy din ang ano niya, yung parang
Mag-delay mo yung progression.
Ma-delay yung progression
Ayan,
ng
delay ng
disease.
progression.
So, remember, these medications will only delay. But if you don't give it, didiretso po tayo dun sa endpoint.
Gaya nung patient natin, Doc, itong case study, nararamdaman daw niya ng hihina. So, he stopped taking the medicine. So, yeah, what could happen pag ganun, Doc?
Ang endpoint niyan will be respiration.
I see.
So the
respiration
way
means-
you breathe, you inhale and exhale because we are helped by our diaphragm dahil nawawala yung supply to the muscle because of nerve deterioration. Nahihirapan na silang huminga.
Okay. Dok, makakatulong ba itong B vitamins na ngayon pala iniinom na natin para lang to strengthen the nerves and gano'n? Can it help?
Pwede naman, but
The
not
supplementation.
really much of the evidence will say that it will truly affect the ALS itself.
Hindi kasi
I see,
siya
I see.
na-address
Oo.
yung mismong
Hindi-
pathophysiology ng
Oo.
sakit.
Okay, I
Oo,
see.
kasi
So,
ang
magpo-progress
motor
pa
nerves,
rin.
Nasa taas yan. Ito yung mga vitamin B, usually peripheral nerves, no? Like from diabetic neuropathy or vitamin B12 deficiency, yun ang makaka-address. But essentially, motor neuron is difficult.
Difficult, yeah.
Motor neuron is really difficult.
It's somewhere there, deep. Okay, now, how do we take care of the ALS patients? First, yung feeding, doc, diba? We have this PEG. Ano po bang ginagawa dyan sa PEG?
Ang PEG, nilalagyan natin siya ng tube into the stomach, no? Short of eating through the mouth, it passes directly to the stomach. Alam ni Dr. Ryan yan. No? There's another way of feeding through the stomach. We call it gastrostomy tube, yung enterogastrostomy. It's just a matter of technicality.
Okay.
Pero PEG is a better, siguro, better route, no? Or better technique. And then, yung iba, dito, NGT initially, but because this is a process that will be permanent, I would rather
Dito na
tell the patient that a PEG, which is a more permanent way of giving the food, is much better than this one.
Okay. Yun, doc, so pumasok doon, nadadigest pa din.
Yeah, nadadigest naman siya, diretso naman yun sa intestine, pababa.
Yun yung susunod kong tanong. Bakit po yung loob hindi siya na-affect nung ALS?
Kasi ang ano natin is voluntary voluntary muscle. It's really the axial muscles and then the swallowing din. Pero yung dito, may mga smooth muscles po yan.
I see.
Oo, usually mga skeletal muscles din ang nai-involve.
So, hindi siya kasama dun sa mga nawawala na stimulation. Umaandar pa rin siya.
Okay, how about the heart, doc?
The heart, actually, hindi rin kasama.
I see. So you can still feel...
So, mas magtatagal din yung patient kung maganda yung heart function niya.
Totoo yun.
Oo. So, that's another
Iba rin yun
thing
kapag...
to consider.
Oo. Iba rin pag merong hypertension,
Oo.
may diabetes, naku, nagsama-sama na lahat ng sakit.
Oh, I see. Okay. Tapos meron din na-discover, doc, na eye tracking device
Yeah.
that can actually pag
Yes,
computerize siya na
Yes.
sinasabi ng patient.
Oo.
Yes, doc.
Yung
please
eye
explain.
tracking device is actually a camera. It's an infrared camera device that tends to detect the fixation or movement of the eyes. Para yung eye, pag nakatingin na siya dun sa screen, that screen will contain icons or
Letters,
words, letters, wherein the patient himself or herself can communicate through either typing by eye, eye checking.
Yun nga eh. Ang cute
Minsan
kanina,
nakaka-text
she was
sila.
able to speak, diba? Pero ito lang.
Oo. And then, it's an independent way of the patient working together with the family, for example. But let me inculcate yung kay Stephen Hawking. He found that yung sa eye tracking is not as reliable as the cheek movement. Kasi merong, di ba yung kay merong siyang cheek movement tracker. Pero yung cheek, meron ding speech.
You see. Ang
Oo.
galing.
Sa kanya,
Nako-convert
So
siya.
you can,
Nako-convert
you
din
can
siya.
ask, I need water, ganun ba?
Oo.
From cheeks. Ang galing.
Yung movement ng cheek niya. So, maganda ito para maki-communicate din yung patient sa mga close family and caregiver. If he needs something,
Yes.
please do
Scratch
something
my-
about my
Yeah.
because
Something
I feel something.
itchy,
Remember,
so-
ang ALS hindi po apektado ang sensory sensation.
Okay.
It's just muscle.
Skeletal
So
muscles.
kapag nasaktan sila,
Na
natamaan
nagkakaroon
or-
sila ng pain. So,
I see.
they need to communicate
Uy,
with
may
the
kumagat sa
caregiver.
akin, something like that.
Oo.
May insect, okay.
So maganda yon actually. But it's a very pricey device to help people with ALS.
Doc, curious lang ako. How do you tell your patient that they are slowly moving to the next phase of the disease?
Matagal yan. Matagal po yan. Actually, ang makakapansin yan will be the family members. Parang hirap nang tumayo. Hindi na siya, yung breathing niya medyo shallow. Tapos kailangan meron ding i-detect na oxygen saturation because when you don't breathe, di ba? Bababa yung oxygen saturation mo. So that in itself is already a basis for or an indication for putting in
A tracheostomy.
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 Okay.
Oo.
So yung nakatrake na si yung patient natin, breathing through the machine na lang siya.
Yes.
I see.
Oo.
So there's no way to reverse it na, Doc. It's like that.
Hindi, nandun na siya sa phase ng terminal phase already.
I see.
Kumbaga, a big percentage of the breathing is coming from the machine na. Kasi wala na stimulation halos yung diaphragm.
All right. Okay.
When it comes to managing a complex condition like ALS, care goes far beyond just a prescription. It takes a village, from neurologists and the physical therapist to speech experts, specialized technology. Doc, what are the available therapies or new technologies to manage ALS?
Actually, wala pang bago. As I've said earlier, there has been an ongoing research that they want to pursue a drug that really will focus on the motor neuron. And what we have in the Philippines, meron naman tayong edaravone. So, meron din tayong physical therapy and speech therapy. But remember, speech therapies are scarce pa din, no? Konti lang
Konti lang
sila.
nagtuturo nito.
But the occupational therapists can actually help. So, in as far as the advanced therapy, hihintayin pa natin until such time na makakalabas itong research na to. And I will go for that. No,
Hopefully,
I will
maganda yung result.
personally attend to the research. Siguro from now on magbabasa na rin tayo how we can help our patients personally.
Yeah. Yes,
Kasi
Doc, and the
nakakaawa
registry nga hindi pa naayos na. Ito ba ay dahil hindi pa nagpapatingin yung mga nasa malalaking
Meron naman nagpapatingin. Meron ding mga registry pero hindi pa ganun kaganda sa Philippines. No?
Hindi pa standardized, kumbaga.
Oo, hindi.
So, usually institutional pa lang yung data
So,
collection.
ibig sabihin,
Meron
Doc,
namang
itong
registry.
3.3 natin ay mas marami pa yan. Na hindi
Actually,
pa natin.
yung 3.3 per 100,000, medyo marami po yun. So, if you study the online registry, masyadong mataas kasi
3.3.
nakikita yan sa mga European. Sa atin, konti lang 0.8 to 1.2, mga ganon per 100,000. Pero yes, I agree that we really need to have a registry just like other medical problems.
Yes, Doc.
Oo.
We gained so much valuable insights today about ALS. Thank you so much, Dr. Lina, for breaking down the science and sharing your expertise with us. Before we let you go, what are your thoughts po na pwede
Okay.
nating iwan sa ating mga viewers?
Okay. ALS is a neurodegenerative disease. We know that neurodegenerative just affects elderlies. Pero ito hindi.
Okay.
So, if you feel something specifically weak on one side of your body, whether it's the hand or the foot, and you develop problem in speech, please consult right away to get the proper diagnosis. Remember, hindi ka naman sasabihin, ay, ALS ka. There are a gamut of diagnostic tests that should be taken kasi marami hong mimics dyan.
Alright.
Hindi lang sasabihin, ay, may ALS ka. No? So, yun siguro yung take-home message ko para lahat ng mga patients afflicted with weakness can have a proper diagnosis and maybe treatment in the future.
Yes, thank you, Doc.
Okay.
Again, thank you so much, Doc Lina. Dr.
you.
Lina Laxamana, Head of the Neuro Department of St. Luke's Medical Center BGC. Top health stories you need to know when we return. Wellness is wealth.
It's seasoned and preserves food, but just a reminder, salt also has healing properties. Salt is medically proven to have specific therapeutic and medical uses coming from Dublin, Ireland. Yoga teacher Jean Frehill introduced salt therapy to the Philippines, bringing the concept of healing salt rooms to Manila as a complementary wellness option.
many city dwellers, daily exposure to pollution, dust, and stress can take a toll on respiratory health. So when breathing issues strike, some turn to traditional home remedies like breathing and steam for relief. But some turn to salt. One of salt's lesser-known benefit, according to some studies conducted, is that it can help clear your lungs. At least some Europeans swear by it, according to yoga teacher Jean Frahil, who spent most of her years living in Europe.
I would actually go to get halotherapy sessions because during winter everybody's sick, just to really boost my immune system, and it's been very effective for me.
Salt therapy, also known as halotherapy, involves breathing in microscopic salt particles in a controlled environment.
So the idea behind this is that we have a machine called a halo generator where it's filled with medical grade salt. And then that salt is grinded microfine particles and it's distributed in the air, creating an aerosol effect in the room.
The healing properties of salt were discovered by Greek, Roman, and Egyptian civilizations. But the modern practice of halotherapy stems from a salt mine in Poland. Polish doctor named Felix Boskowski first documented in 1843 in Wileska salt mine that men working in the salt mines rarely had respiratory and lung diseases compared to other miners.
And so from here, he made the connection that maybe there's something being in a salt mine, right? And then he decided to take a look at the properties of salt. What did it have? Why were these people not getting that illness that everybody was getting? And that's when he discovered, of the healing properties of salt.
Salt is known for its antimicrobial and antimucolytic properties. For people with respiratory issues and other health concerns, many turn to salt therapy for respiratory support, relaxation, and a natural way to help clear the airways. Advocates like Jean vouch for it. She says breathing in microscopic salt particles may help loosen mucus, promote easier breathing, and create a calming, stress-relieving environment for both body and mind.
Abroad, they use it for people with respiratory issues, asthma, COPD, bronchitis. For people with skin issues, it's quite helpful because like eczema, psoriasis, there's really not any cure for that. There's just really managing it. So sitting sessions in the salt room can be helpful for them as well.
There are different ways to experience salt therapy, Jean says. The most common involves simply sitting or lying on your back in a salt room. More advanced sessions may include wellness activities like massage therapy, yoga, or sound healing. But for Jean, the best combination is guided meditation and breath work.
So with breath work, right, we are manipulating how we inhale, how we exhale, which becomes very potent.
Cleveland Clinic confirms that salt therapy is generally safe. Salt therapy is finding its place in the world of wellness and better living.
And here's our health updates. Hindi na kailangan mangamba kung kakailanganing sumailalim sa isang spine surgery. There's a new surgery imaging system para maiwasan ang pagkakamali sa operasyon.
Kapag nagkakaproblema sa spine o gulugod, karamihan ay natatakot na ipagalaw ito. Sensitibo at delikado kasi ang bahaging ito ng katawan. Magalaw lang ng kaunti, ang anumang nerve na nakapaligid sa spinal column ay maaari na magresulta sa pagkaparalisa o panghabang buhay na damage at malfunction sa ilang bahagi ng katawan. Pero gamit ang makabagong O-arm surgical imaging system, mas less umano ang tsansa na magkamali o magkaproblema sa spine surgery. Mas accurate kasi ang nakikita dahil sa real-time 3D intraoperative images ng O-arm. Specially designed ito para sa spinal at orthopedic surgeries.
It allows you to see, again, what you don't see from the surface. And with this guidance, you are assured that you're placing it exactly where you want it and away from the structures that you don't want to touch, specifically the nerves. So in terms of safety, the most this machine can afford us is the safety of the surrounding nerves, which is a primary concern when doing spine surgery.
Exceptional clarity kasi ang kailangan kapag naglalagay ng screws at rods or implants sa gulugod para sa mga pasyenteng may problema sa stability ng spine. Sa lumang pamamaraan ng operasyon sa spine, ang likod na bahagi lang ang nakikita sa imaging at gumagamit ng x-ray para makita ang ibang bahagi at magre-rely sa pagtatansya ng sorihano. Pero sa O-arm, mas sigurado.
The O-arm, together with the stealth station, is a computer navigation system designed to improve patient outcomes for patients undergoing spine surgery and orthopedic surgery. It's basically an image guiding system that would help surgeons place in implants to the patient more accurately and precisely.
Kaya naman sinasabing mas safe ang spinal column operation gamit ang O-arm. Epektibo din daw ito para sa operasyon ng scoliosis, trauma na ginagamitan ng malalalim na implants gaya ng hip fractures at intra-articular fractures o paglalagay ng implants sa loob ng joints. Malaking tulong din daw ito para sa neurosurgeries at ENT, facial bone surgeries. Inamin naman ng mga eksperto na madadagdagan ang gasto sa operasyon gamit ang O-arm. Pero cost-efficient naman daw ito dahil less ang tsansa na magkakomplikasyon o mangailangan ng panibagong operasyon. Faster recovery din para sa mga pasyente.
Isang smart building naman ang new building ng St. Luke's Medical Center in Quezon City.
Pinasilip ng St. Luke's Medical Center sa Quezon City ang bago nilang building na malapit ng makumpleto. Ito umano ay magdadagdag ng 120 bed capacity sa ospital. Aasahan din umano ang improved accessibility and convenience para sa mga pasyente. Magiging smart building daw ito kung saan mas madali umanong mananavigate ng mga pasyente. Makikita na dito lahat ng makabagong diagnostic areas at laboratories, mga modern operating suites at mga specialized care spaces.
Today, we mark a milestone, but more than that, we advance a mission. For over a century since 1903, when we began as a small dispensary in Tondo, Manila, St. Luke's has always stood for one thing. We put our patients first. This stands today because you believed long before it was certain. This structure represents more than steel and concrete. It carries the trust of every patient who will one day walk through these doors. Because every space here will hold a life that deserves excellence, a life that depends on compassion.
Maiiwan naman sa lumang building ang 20% na hospital service kabilang ang emergency room na magiging mas maluwang na, pati ang women's care facility.
That wraps up our look into the evolving world of ALS treatment and management. While the road ahead is challenging, the dedication of researchers, the resilience of patients, and the strength of the caregiving community show us that no one has to fight this disease alone.
If you or a loved one are navigating an ALS diagnosis, remember, you are not alone. Reach out to the ALS Philippines to connect with care services, support groups, and vital resources for the latest updates on treatments and research breakthroughs. See you all again next Sunday. Live well.
Live wealthy.
Wellness is wealth.